Good afternoon. Rich Fitzgerald, County Executive here with Dr. Deborah Bogan, Health Department Director, here with our weekly update on the COVID-19, losing my thoughts, but anyway, the COVID-19 pandemic. This is our first full week in southwestern Pennsylvania in the yellow phase, and thus far our numbers continue to remain good on new cases, hospitalizations, fatalities. We know it's early yet, but early indications are that as offices opened up this week, as retail opened up this week, and childcare opened up this week, the reports that we're getting are there's been a great level of cooperation, that the business community has still tried to keep as many of their workers teleworking from home as they can, and a lot of that has been evident by what we've seen. We know we still have a long way to go, and we know as the weather gets nicer and people want to get out, that those challenges will remain. We also know that for many folks, they're still not opening. Other businesses that may see opening in the future, things like restaurants and hair salons, gyms, nail salons, et cetera. We know they're still not open, but we've seen real estate and other activities, car dealerships, offices, as I said, come into operation just this week. We want to continue, again, the great level of cooperation that's occurred throughout this region, listening to our medical experts, taking their advice very seriously. We also know that as we come upon Memorial Day weekend, that's the kind of the unofficial opening of summer for so many of us that we've enjoyed so many years. And I know for me, it's always been a very special day to go around to various parts of the community, engage in ceremonies that occur to thank our fallen heroes and their families for the sacrifices that they have made. We still want to remember those heroes this weekend. Unfortunately, obviously, a lot of the parades and a lot of the public gatherings won't occur. They'll occur remotely and on Zoom and virtually and in other ways, but we still want to make sure that we continue to thank those heroes. We also know that it's a time of gatherings. Families get together. Family have backyard picnics and those type of things. We know people are going to want to do that. We just, again, if people are going to get together, keep that physical distancing. Not too close. We can be talking to each other. We can still be together. Have that nice cookout in the backyard. But let's make sure that we keep that physical distancing. And please, wear your masks, wash your hands, all the things that we've been learning over the last number of months. So we want to continue that. So we want to have a nice, safe summer, and we want to continue to move into more open things. We want to open up some of those businesses that I talked about that really have been suffering through a lot of this economic devastation that this country and this state and this region has been enduring since early March. So with that, I want to open it up to Dr. Bogan to say a few words, and then we'll open it up to questions. Dr. Bogan?
Thank you, and good afternoon. So we are almost through our first week in the yellow phase, and it's too soon to tell if there's going to be an increase in the number of cases in our community. We know it can take on average about 5 days from the date of exposure to the infection to the coronavirus to show symptoms, and then a couple days to get a test. So realistically, we won't know if there's an increase from reopening for about 10 to 14 days at least. But hearing from all over the county that people are still staying home, practicing physical distancing, wearing their masks, taking care of themselves and others is great, and we need to keep that up. As Rich Fitzgerald just told us, Monday is Memorial Day, the unofficial start of summer, a day many of you look forward to all winter and spring, including myself. Whatever your plans are for the holiday weekend, please keep health and safety at the forefront and continue to follow the guidance we've provided. Also, remember to limit gatherings to 25 people or fewer, keep 6 feet apart, wear your masks when you're around other people. Have hand hygiene and cleaning supplies on hand for any gathering. This includes soap and water or hand sanitizer and a disinfectant sprays or wipes. Wash your hands and clean those surfaces frequently. If you're hosting a picnic or a cookout, limit the number of people who prepare and serve food. Have guests wash their hands regularly. Designate one person to handle serving utensils and keep food protected from sneezes, coughs, or droplets that may contain the virus. If you're out walking, running, hiking, biking, kayaking, or otherwise enjoying nature, please be sure to keep at least 6 feet from other people. It's a good idea to carry a mask if you come by other people and need to sort of scoot around them quickly. We're asking you to keep physical distance this weekend, but not social distance. Let's connect responsibly as we honor those who died fighting for our country. So for the last few weeks, I've been promising you that we are working on getting testing to our federally qualified health centers. And I'm very happy to say that last Friday, the Health Department, the Richard King Mellon Foundation, Argo AI, and our federally qualified health centers around Allegheny County announced a major expansion of testing in the county. Our goal is to have testing widely available in order to better control the virus. Anyone who is showing symptoms of COVID-19 should be able to get a test quickly and easily. We hope with the expansion of testing to our FQHCs, we're getting closer to that goal. The 6 federally qualified health centers providing testing are Primary Care Health Services, Squirrel Hill Health Center, Northside Christian Health Center, East Liberty Family Health Center, Stowe Rocks Family Health Center, and Metro Community Health Center. The program is also supporting testing through Pittsburgh Mercy, which is a certified community behavioral health clinic. To schedule a test, you can visit AlleghenyCovidTesting.com. I'll wait for you to spell that out. People can call the clinic, any of the clinics, but particularly the ones closest to them, and get an appointment even if they've never visited the clinic before. The test sites are also listed on our county website. Testing at the FQHCs around the county is offered at no charge and regardless of your insurance status. I want everyone to know about our federally qualified health centers because they're really an important resource for our community. They provide comprehensive health care to anyone in the community, including people with health insurance, people without health insurance, and people who are underinsured. The federally qualified health centers receive federal support to be able to cover care to underinsured and uninsured people. And at the FQHCs, people pay based on what they can afford, and many people pay nothing. They're an incredible resource for all of our communities, and I hope you all know about them and reach out to them as you need services. Many of the federally qualified health centers are located in communities where people might not have had access to testing before. And so again, we hope that this expansion gives access to more people. As we put out in the press release last week, the R.K. Mellon Foundation purchased 2,000 COVID tests, and the Health Department purchased an additional 3,000 from a company called Curative Inc., which is a California-based company that has been providing testing to Los Angeles and other sites across the United States. What we really liked about this tests, the Curative tests, is that they're easy to use. It's an oral swab, and it's non-invasive and not painful. So the person self-swabs their mouth for about 20 seconds, places the Q-tip into a vial, covers it, puts it in a bag, and can hand it back to the provider. And it requires no refrigeration, so again, it's easy to use, and it is not at all painful. So we've also partnered with Argo AI, which is using its expertise in route planning and fleet operations to pick up all the tests from across the county and deliver them to our health department lab, which overnights them to Curative in California. Results are available within a few days, and we're working with Curative to make the turnaround time even faster. Testing started last Friday, and as of today, the federally qualified health centers have sent over 60 tests, and we know the results of 40 of those already, and only 2 have been positive. We will be watching these results closely as they will give us more information about the spread of COVID-19 in our communities served by the health centers. So with that, I wish you all a safe and healthy Memorial Day weekend. Stay well. And I'm going to turn this back to Rich.
The first question that we have is from both WPXI and KDKA Radio, and it's something that you touched on in your remarks, but you're being asked if you could address the comments about restaurants, barbershops, hair salons, and gyms, and whether those types of businesses should be allowed to open. And as a follow-up, how long do you think it will be until that can be done safely, and have you had any conversations with the governor about that?
Well, we've certainly had a lot of conversations with those various industries that you mentioned, hair salons, gyms, restaurants, et cetera. And I'm really pleased to see the thoughtfulness and the work that has gone into the plans that these various organizations and various businesses have put together. Very, very sound and safe business practices about physical distancing, about barriers, et cetera. So I think at this point, it's probably time for the state to really consider moving some of these businesses that have very, very sound plans and ways in which they can keep the physical distancing of both their employees and their customers in that range. My sense is that the state is considering that. I can't give a timeline on that, but I would imagine maybe within the next few weeks, maybe to late May, early June to mid-June, we could see that happening. The one thing is these businesses have really been suffering. We know these are small businesses and many of them mom and pops who have invested their life savings, their life's work and everything else into their businesses and into the work. And to keep them economically deprived for a very long period of time is just, it's number one, probably not fair, but also very, very detrimental to not just the individuals, but the community as well. So as we continue opening up more and more into the yellow and more businesses open up, the need is there, both from the customers and certainly from these people that want to go back to work and want to have their businesses open up. I also would be, remiss if I didn't also echo the words that Dr. Bogan gave and thank Argo AI and RK Mellon and the groups that have been really working together to make sure that the tests are available for folks that need to have them.
This next question is from WESA for Dr. Bogan. During a meeting of Put People First PA yesterday, speakers called on the county health department to create a mobile coronavirus testing unit to travel to low-income areas. Do you have any comment on this? And is the county providing any additional testing besides what's occurring at the FQHCs that you just mentioned?
Yeah, those are great and important questions. So as you probably know, Allegheny Health Network does have a mobile testing service and has been going out to many sites around our community. They announced today that the mobile testing unit will be outside the Shop and Save Plaza in the Hill District on Thursday, and it was in Homewood yesterday. We hope to see sort of the use of this mobile van service expand. And again, I understand that they have spoken with the folks in Duquesne, and I hope that the van will go there in the future. Are we providing additional tests? We have been providing for a long time now limited testing at our Allegheny County campus called the Clack campus in Lawrenceville for EMS workers and others who need testing. That's been fairly limited, and we've also been coordinating with emergency medical services to do some home testing as needed across the last few months, and we have done more than 50 tests in people's homes when those have been needed.
The next few questions are also for Dr. Bogan. From the Post-Gazette, do you think that reporting the numbers for nursing and personal care homes the way the state has begun doing benefits the public and families of residents in any way? And if so, why?
I actually, I'm very pleased that the state is now providing those numbers. I think, we all worry about our family members in nursing homes and in long-term care facilities, and the more we know about what's happening in those homes, the better. And as you know, from the start of this pandemic here in the county, our Kane centers have been completely upfront and transparent with their numbers, and I'm glad to see that the rest of the state is doing the same now.
The follow-up question to that, I think you've also just touched on, but I'm going to ask it in case you'd like to add to anything. Families of residents say they've heard little to nothing from the nursing home managers about what is happening inside the homes that have had large outbreaks. Do you think nursing homes should communicate conditions inside the nursing homes better?
I do. I think it's imperative for nursing homes to keep the families of who they're caring for updated about what's going on. It's essential, right? That is the role of healthcare, is to provide good communication with other people.
This question is from the AP. Could Dr. Bogan speak to the difficulties involved in testing every resident and employee in a nursing home in Pennsylvania?
That is a plan put out by the Department of Health, so I'm going to let them talk about it in depth. But any sort of large-scale testing really does present challenges, both with staffing, with getting the kits out and getting them tested and processed quickly. So it is really a logistics challenge for a large-scale testing.
I believe we touched on this topic last week as well, but the Post-Gazette is asking how many people are doing contact tracing in the county and how many more are needed. We see that the health department is advertising to hire contact tracers. Could you also tell us the total cost of contact tracing and how that cost will be paid, and any other information, including how many cases that contact tracers have been investigating?
Wow, that was you want to break those down for me one at a time?
Sure. How many people are doing contact tracing in the county and how many more are needed right now?
So right now we just have a few people doing our contact tracing because the numbers, as you've seen, have been low. And because people have been staying home, the numbers of contacts are low. So we just have a few people currently doing it. But again, we are planning for expansion of that effort as if cases increase, because as people are out and about and going to work and getting on buses, the numbers of contacts for each case may increase, so we'll need more. And we, as I said last week, have sort of a wide range of what we can provide for contact traces. And we have a plan to sort of expand out as needed and contract when we don't need as many. And I think I went through the details of that last week.
The other question that was included in that was what will the total cost of contact tracing be and how will that cost be paid?
The total cost is unknown at this point. It depends, again, on how many contact tracers we need. And we are committed to making sure that every contact is reached of every case. So the cost will depend, and we have, again, budgeted sort of a wide range depending on what that looks like. So I can't give you an exact budget.
This next question is for the county executive from the Pittsburgh Business Times. Now that we're in the yellow phase and have been for almost a week, are you turning your thoughts to how the county will move into a green phase? What will it take for that to happen? And how long do you think it will take for the county to get there?
Yeah, I certainly think of that constantly. I mean, we want to continue to open up as much of our economy as we can in a safe manner and have those discussions. Before you asked about talking to the governor, talk to the governor and his team all the time, many times a day often, but certainly many times a week about all these issues and some of the businesses we talked about before that have still been shut down. We've certainly had many discussions along those lines. And as Dr. Bogan said, as the testing results remain low, and it's still very early in the yellow phase because there's a little bit of a lag time between the time we entered yellow to when the tests and the results would actually come back. But we do see, as this improvement continues, we want to continue to move in that direction. I don't know that the total definition of what green means is there yet, but what I do know is even in the yellow phase, we could see more things open up. If you recall back in the red phase, we saw things open up like manufacturing, construction, golf courses, other kind of recreation, things like that began to open up. So we'll continue to do that. And I also want to just touch on the budgetary question and really want to thank and praise County Manager McCain, the great work he's been doing, because as you're dealing with a pandemic, obviously there's needs in certain departments that might not have been foreseen when the budget was adopted last year, and other needs maybe not is needed to be as much. So the manager has really done a great job with all the department heads, working with his deputy managers, obviously working with Dr. Bogan and her team to provide, whether it's contact tracing, whether it's testing, whether it's PPEs, whether it's, whatever it might be. And along those lines, I'm going to talk about elections a little bit. I mean, we've got 13 days from now, the June 2nd primary, which was moved back. And we've encouraged so many people to vote by mail, and it's been it's been a great turnout so far. It's already been more than anybody anticipated. The county manager was able to move folks over to process all those applications, but we still are encouraging people, if you have not applied, you got 6 more days to do so. And we encourage everybody to stay safe, but to participate in the democratic process so you can vote for the candidate and candidates of your choice. and do so safely through the mail. So, again, there's a lot of folks that you don't often see who are behind the scenes working very, very hard on behalf of the citizens of the county and the region to keep people safe.
Since you added on to your question, allowed that reporter to send a follow-up question. What are the businesses that you believe or hope would be allowed to reopen by mid-June? Or is that just hair salons and barbershops that you mentioned, or are there other types of businesses you think could also fall into that category?
I think those are the ones that we see probably most likely to be next, restaurants and at least restaurants with some outdoor seating. I know Mayor Peduto has put forth a plan that seems to make some sense to allow some outdoor seating in certain streets in the city that would, again, continue the physical distancing that's allowed. I think some of the plans that have been put forth by some of our friends in the hair salon business and the nail salon business and the gym and health business seem to make sense, and I think they're plans that should be considered in a good way. I can't give a date. I don't. It's not an authority that we have here locally with Dr. Bogan and her team or myself, but we could certainly see and advocate for folks that are really feeling some economic pain that's occurred since March. So we want to continue to have those conversations and obviously monitor the testing, monitor what's going on in the community, do the contact tracing so that if any numbers do start to go up, we can take action that would be appropriate.
This next question is for Dr. Bogan. From WESA, some people are forming pods with small groups of friends or family. People within the same pod don't physically distance from each other, even though they don't live together. But the pod will practice physical distancing with people who are outside the pod. This strategy allows people to have some social contact, but limits exposure to the coronavirus. What do you think of this approach?
I think it's a great approach. I think it really, people are really sick of being in their houses, and they're really sick of seeing, just the only people who live in their households. And this allows sort of a very gradual expansion of people's physical and socialization. So I think it's a wonderful idea, and I encourage people. I know there's a lot of rules that people set around those, and I think it's careful to read those rules because often they do require some quarantining for a while to make sure you're not sick and bringing that into your pod. So I encourage people to read about what I've read about the pods and the rules that people have posted as a way to sort of develop them on your own. But again, go for it.
The next question is for you too, but in the meantime, there's going to be some breaking news here, so I apologize in advance. The question is also from the Tribune Review. It's asking about if there's any update on the delay in data, but literally 3 minutes ago, the data came in from the health department. So while this isn't the full complement of data, there are 1,687 cases reported for Allegheny County today. That's both confirmed and probable, and 144 deaths, again, confirmed and probable. So the question is, could you describe which data points are collected directly by the county and which ones are reported to the state first by you?
So all of the data really starts in our NEDS database, and the NEDS database is a state database. So the labs report into the NEDS database directly, and then we get access to our county level data from that NEDS database. So they're not reporting to us directly, they're reporting through NEDS, and then we get access to the data. We do have, we were able to see, by the way, the cases this morning, so we could respond to cases that were positive and start our case investigation, but our total picture was limited in terms of reporting out.
And this is the final question again for Dr. Bogan for KDKA Radio. Can anyone get tested at the FQHCs, or are symptoms required?
So in general, symptoms are required, but there are special circumstances which the federally qualified health centers can decide on their own. So for instance, if they have a worker who's been exposed to a lot of people and they're very worried, they may make the decision to do that testing. We've really left it up to the physicians at the health centers to make the best medical choices they can. Again, the general rule is people are getting tested if they're symptomatic, but we gave that is the prerogative of a physician to make that decision based on their best medical knowledge.
That is the last question, unless anybody has any closing comments.
First of all, thank you all for your questions and the interest in trying to get information out. Again, I want to thank, as we come upon Memorial Day weekend, thank our heroes who have allowed us to live in the freedom that we live in. As I mentioned, elections are coming up. It's a lot of folks who have fought to give us those free elections. So we hope that people would participate in the democratic process and certainly do so safely and take advantage of the fact that we now have vote by mail, which allows it easy for people to participate. I'd also, again, want to thank the folks who week after week after week, day after day after day, our first responders, our nurses, our jail guards, the people who work in congregate care facilities, who take care of our most vulnerable people, who are our grocery clerks, who do the work at our pharmacies, who provide service to the public and really go out every day to serve us. The folks in I can tell you, at county government, but at all levels of government, who are out there doing the public service work to keep people safe through this pandemic and make sure that we come out on the other end in a healthy way, as healthy as we can, but also to have our economy move forward so people can get back to work and get back to their normal lives. So we, again, as we've said from the beginning, we want to continue to cooperate. We want to continue to come together by staying apart and stay safe and have a good, healthy, and happy summer. Thank you.
Thank you for joining us. The COVID-19 daily update with all the data from the NED system will be issued shortly, and we'll see you next Wednesday at 4 p.m. And Ryan hung up on me before I was done talking.